sir, you are audible.
Okay, thank you. We started this particular webinar series on pathology to enhance and update the knowledge of Ayurvedic Vikruti Vigyan PGs as per time. Today, this webinar on interpretation of squamous cell abnormalities in Ayurveda with special reference to cervical dysplasia. Today, we are having eminent personalities for this webinar series. Dr. Heman Kalita sir as a guest speaker, Dr. Santosh Chavan sir as a chairperson, and our RVPJ president, Dr. Subhash Waghe sir. Before I start, I would like to invite our spokesperson, Dr. Mrunal Boyar madam, to introduce our RVPJ organization.
Thank you, sir. Am I audible, sir?
Yes, ma'am.
So good afternoon and namaste to everyone. Myself, Dr. Brunal Bhoir, working as an associate professor in Rog Nidan Department, Paru Institute of Ayurveda, Gujarat. I'm here to give a brief introduction about Rog Nidan and Vikruti Vigyan Postgraduate Association. So our organization, RVPGA, was formed in the year of 2016 under the able and dynamic leadership of respected Dr. Subhash Waghe sir, with an aim to give legal status to pathologists and radiologists and the PGs of Rog Nidana specialty. Ours is the organization is duly registered under the Societies Act of 1860 at Charity Commissioner Office, Nagpur, Maharashtra. Postgraduate students, teachers of Rog Nidan and Vikruti Vigyan can become our member. Ours is the only organization which is fighting for the lawful rights of Rog Nidan PGs. Even the NCISM had also directed State of Maharashtra to consider RVPGA as a stakeholder in the constitution of pathology regulatory body of the state. RVPGA is pursuing this matter with state, also with the central government. Not only this, the RVPGA is constantly pursuing the implementation of NCISM salary structure in all the private Ayurvedic colleges across the nation. All the communication, all the announcements are uploaded duly on our website, www.rvpga.com. This is our official website, www.rvpga.com. Some activities I am mentioning. First is the regular conduction of online webinars and offline seminars, both on national and international platform. Hands-on training program for PGs at our partner NABL accredited pathology laboratory at Mumbai, Pune and Nagpur. Publication of research papers of Nidan students as well as faculties in our peer-reviewed international journal of diagnostic and research, IJDR. Interested can visit the journal site www.ijdrindia.com, www.ijdrindia.com. Edited book volume series through our international publication, RIPI, which is registered in Government of India's ISBN portal. Those who want to contribute book chapter can visit RIPI website, www.ijdrindia.com. Edited book volumes series, these are published through this website. We do legal fight for the issues of Rog Nidan and Vikruti Vigyan PGs at the appropriate forums. We have our YouTube channel, also the Facebook page where you can see all the educational activities, all the associated activities of RVPGA. Thank you. Over to you, sir. Heman, sir.
Thank you, ma'am, for precisely introducing our RUPGA organization. Now, I would like to invite Dr. Avinash Wade sir to introduce and welcome our today's guest speaker.
Thank you, sir. Am I audible?
Yes, sir. You are audible.
Okay, thank you, sir. Good afternoon, everyone. Myself, Dr. Avinash Wade, Assistant Professor, Rog Nidan Department, Noble Ayurveda College and Research Institute, Noble University, Junagadh, Gujarat. I heartily welcome on behalf of RVPGA to all participants. First of all, I welcome our chairperson of today's session, Dr. Santosh Chavan, sir. I heartily welcome you, sir. and I welcome Dr. Subhash Page, sir, the President of RVPGA. I welcome you, sir. The topic of today's webinar is interpretation of squamous cell abnormalities in Ayurveda with special reference to cervical dysplasia. It's my honor and privilege for me to introduce today's guest speaker, Ayurveda oncologist, respected Dr. Hemant Kalita, sir. I give a brief introduction about sir. Dr. Hemant Kalita, sir, is Associate Professor in the Department of Rog Nidan at Government Ayurveda College, Guwahati, Assam. Sir has done BMS from Guwahati University, postgraduated in Rog Nidan from Pune University, and PhD from Guwahati University. Sir teaching experience is more than 14 years and PG guide from last 9 years. In research experience, Sir has involved in various research activity in Government Ayurveda College, Guwahati, and other years. Sir has published more than 50 research article in national and international journal. Dr. Kalita, sir, as a professional experience, consulted at specialty clinic for cancer at Government Ayurveda College and Hospital, Guwahati. As a faculty consultant at Rognidan OPD and IPD at Government Ayurveda College and Hospital, Guwahati. Sir has own Ayurveda oncology practice in Guwahati city. Also, sir has involved in cytology and histopathology works at Government Ayurveda Hospital Laboratory, Guwahati. Sir has attended special CME at All India Institute of Ayurveda, Delhi on integrative oncology. Sir has specially interested in cytopathology, histopathology, microbiology, oncology, and etc. Special contribution of doing FNSC, pap smear, fluid cytology, culture and sensitivity at Government Ayurveda College, Guwahati. The last but not least, Sir has been awarded by our association RVPJ in 2021 as a Nidan Sri. Thank you all, and I request to guest speaker, please deliver lecture. Thank you, sir.
Am I audible?
Yes, sir.
So, namaskar to all of you. So it's my privilege to be among all of you in this big forum of Rognidan Vikriti Vigyan and PG Association. Now, before starting my presentation, I'd like to offer my thanks to Rog Vigyan Vikriti Vigyan PG Association, especially Dr. Subhash Page sir, for giving me the opportunity to stand in front of all of you. So actually, I am a member of Rognidan Vikriti Vigyan PG Association, and so I am nothing new for all of you, but the responsibility for today's presentation had given to me so that I can say something, the experiences, whatever I have gathered in my last 14 or 15 years of teaching experience over here in Government Ayurvedic College, Guwahati. So whatever the presentation I'm going to do it in front of you, it's only just a part of my own experiences, whatever I have gathered. And before presenting, I'd like to say this presentation will be specially for those students of Rognidan who are doing or answering their degree in our subject. So those students who are involved in our subjects actually may be helpful of all these things. So whatever the inputs I have come for in front of you, it's only just a kind of a discussion. So let me start with the presentation with due permission from the chairperson, sir. So today's my topic is interpretation of squamous cell abnormalities in Ayurveda with special reference to cervical dysplasia. So first of all, with the introduction, so all of you know that what is epithelial cell. So it's one of the major tissue groups that is found in the human body, found in the different parts of the human body, like the oral cavity, like the digestive systems, like the cervix and all. And actually, the epithelial cells, they are mostly of two types. Actually, one is the simple, another is the stratified. And the simple epithelial cell, all of you know, is of three types. It is the squamous epithelial cell, that is the cuboidal, and the columnar epithelial cell. Now, as because our today's presentation is only on the squamous epithelial cell, so my presentation will be only focused on only on the squamous epithelial cells. And we know that the squamous epithelial cell, those are mostly found in the protecting layer of the body, that is in the esophagus or in the mouth, that will be in the cervix or vagina, where there is wear and abrasion. So in order to protect the part of the body, the squamous cell, uh, epithelial cell comes into the part. Now, this is just a pictorial presentation of the epithelial cell. All of you know, already I have mentioned, that is mostly, it is of the simple squamous epithelial cell, just simple cuboidal epithelial cell, and the simple columnar epithelial cell. These three varieties come under simple epithelial cell. And the stratified squamous epithelial cell, it's a group actually. All these groups, when they make a tissue, that is called as a stratified squamous epithelial cell. Now, come to this, if you know that what is a epithelial cell, now what is the epithelial cell abnormality actually? Now, epithelial cell abnormality, when we say the terminology, we actually mean that there is something abnormal that we see inside the epithelial cell. And when there is a change in the epithelial cell, it indicates either a precancerous stage or either it is a cancerous stage. So for this, generally, in doing pap smear, we find many types of epithelial cell abnormalities. This is one of the very commonest method we see in the gynecological practice to find out whether there is any pathology happening in the cervix or not. Actually, that is what. Actually, that is nothing. That is a actually test to find out whether there is any kind of a epithelial cell abnormality or not. But this is not that only pap smear or the pap test is the only test for which epithelial cell abnormality is detected. It can be detected for the other tests also. So other tests, sometimes it may be rectal swab, either it may be any kind of other swab also. We may find out the epithelial cell abnormality. But our today's presentation is based on the cervical dysplasia. So we have to understand what is cervical dysplasia. Now, when there is a epithelial abnormality, we find out in case of a cervix, that is called a cervical dysplasia. And the cervical dysplasia are detected by the pap test. Now, this is actually the need of the study. Now, why this presentation or why these types of studies are important for us? And as we are an Ayurvedic doctor, there is something we have to understand beyond the science of the modern also. Now, all of you know that the cancer, mostly the cervical cancer and the breast cancer or the ovarian cancer, they are rising day to day. And generally for the cervical cancer, all of you know the pap smear is the simplest method and the most important method for diagnosis of cervical cancer. And the important thing is that if in the day-to-day practice, in everywhere, all of you know that due to the rise of this cancer, many patients, they also visit for the Ayurvedic treatment also. And when they visit any Ayurvedic doctor, somebody is actually I can mute the microphone, I think. Okay. So when people used to come to us as an Ayurvedic doctor for the treatment or for the prevention of cervical dysplasia, now generally they come with the reports actually. Now when they come with the reports, that means generally the pap test or the pap smear test report, now it becomes important for an Ayurvedic doctor to know about the results of the PEP test and also to interpret the results of the PEP test in the language of Ayurveda. Because without interpretation, this is not possible for us to go for the treatment. So this is actually for us that we have to understand the science, the modern science, and then we have to interpret in our language. Then only the Ayurvedic treatment is possible, because in today's world we want a evidence-based study. So for evidence-based study, the interpretation of every test are important. So the PEP test or the cervical or the squamous cell abnormality interpretations are also essential. So before starting is we have to know what is the squamous epithelial cell. Now the squamous epithelial cell, this is the outermost cells which is found in the epithelial tissue, and this actually seems to be just like the scale of the fish, no? And so the cell is flat in nature, and so the Latin name comes from squama, and the squama means scale, the scale of fish. So they are found in alveoli of the lungs, they are found in the blood vessels, they are found in Now, coming to our part today is regarding the cervical dysplasia. This is a pictorial presentation, all of you know, and I would like to say this is the cervix. This is the cervix, and this part is called as the endocervix, and this part is called as the ectocervix. So this ecto and the endocervix, this whole part is lined by epithelial cell. Now there are two types of epithelial cell we found here. Now if we consider about this the endocervix, this endocervix is lined by squamous epithelial cell, and this ectocervix, it is lined by the glandular cell, that is the columnar epithelial cell. So this is the endocervix, and this is lined by this columnar epithelial cell. These are the long column cells, and these are long column epithelial cells. These are called the columnar epithelial cells. Mostly the secretory cells are actually we find out here the secretory cells, and this part, this is the squamous epithelial cell. These are the flat cells. This is the squamous epithelial cell. Now today we will be going to discuss how what type of abnormality we find out on this part. What type of abnormality we can find on this part. That means any abnormality on this part may lead to a precancerous, or it may ultimately may lead to a cancerous stage in the study. Now this is how we look. This is how we look in the pap smear. This is what I have mentioned. These are the squamous flat epithelial cells. Squamous flat epithelial cells. These are found in the endocervix, and these are actually the nucleus part. These are the endocervical cells. These are the endocervical cells. These are found in the endocervix. So this is actually the cells, whatever we observe it under microscope during the pap smear. Now, this is what the normal histology of the cervix. Now, this is a normal histology of the cervix. You can find this is a bundle of cells over here, and bundle of cells means 2 or 3 types are over here. So it is a stratified squamous epithelium. So what we see here, if you see this histological part, this is the basement membrane. So this is the basement membrane. So this is divided into 3 parts. One, these are called as the basal cells or the basal layer. Then this part, this is called the intermediate zone, or this is composed of intermediate zones or intermediate cells, and the superficial zone, that is the superficial cells. Now all these 3 zones are composed of different epithelial cells. Now these different epithelial cells, these are all squamous cells, but these squamous cells are of 3 different types. Now these basal cells are these basal zones having the cells, these are also squamous epithelial cells. These are called as the basal cells, and the intermediate also having some cells. These are called as the intermediate cells, And the superficial, these are called as superficial cells. So these are all squamous epithelial cell, but of different zone. Now, this is how they look actually. So this is the most outermost cell that is in the superficial zone, and these cells are called as the superficial cells. Now you see how these cells looks. They are flat cells, and they are having a very small nucleus are there. These are called the pinotic nucleus are there, and the size of the nucleus are very small. They will be something 15 micrometer, 10 to 15 micrometer in diameter. This nucleus, and if you see the cytoplasm over here, they are all eosinophilic or they may be organophilic. Now, why they are eosinophilic or organophilic? Because they are a deposition of some keratin over here. So they are all these we find out in the superficial layer, and they used to doesn't retain in the body. They used to go out from the body during the time of menstruation and all. So they are all mature cells. So they are got mature. So the keratin is deposited. So there seems to be eosinophilic or organophilic cytoplasm. So these are the superficial cells. They look like this in the microscope, and these are the intermediate cells. But there is a difference between this cell and this cell. Now, these intermediate cells are also flat cells. These intermediate cells are also flat cells, but you can see the nucleus is bigger. Here, the nucleus is about 10 to 15 micrometer in diameter. Here, the nucleus is about to say 25 micrometer in diameter. So the nucleus is bigger, and here you don't see any kind of keratin deposition, or you don't see any kind of eosinophilic. These are flatly, these are cytoplasm is there. So this is the how it looks like. These are called as the intermediate cell. Now coming to this, the basal zone. In the basal zone, two types of cells are found. These are the called as the parabasal cells, and these are the basal cells. So these parabasal cells are also squamous epithelial cells, but they are oval in shape. It may be oval, or it may be circular or semicircular. But the difference is with the nucleus. Now here the nucleus is much bigger. Now this nucleus, it is about 50 micrometer in diameter. It is 50 micrometer in diameter, but they are all squamous epithelial cell. They are normal, but they are in the just in the basal part of the cervix. So this is something about the normal histology of the cervix. Now coming to this, when there is abnormality. Now you can see here, these are the normal cells. These are the normal cells, but due to various cell injury, we know there is a cell injury. After that cell injury, there is a transformation of the cells, and that is we under the headings of cellular adaptation, we know that a normal cell can convert it. It may go to metaplasia, and after metaplasia, it may go to dysplasia. And after dysplasia, there is a cancer. So this transformation from the normal to abnormal, that means there will be abnormality in the structure, shape, and also the function. That is called as the dysplasia. And in case of cervix, this is a dysplasia, and after dysplasia, there is a malignancy. So this is the precancerous stage, and this is the cancerous stage. So we call that the daughter cell. These are daughter cells. The daughter cells does not resemble with the parent cells. So actually, this is the motto why every female after 30 years of age, actually, the government had indicated for a pap smear test, because we doesn't know that what is going on inside the body. So there may be transformation. So if there is a transformation from the normal cell to the dysplasia, it can be prevented if pap smear is done. And if the pap smear is done, if you find out any kind of a dysplasia, proper treatment can be given, and after the proper treatment, the cancer can be prevented. The cervical cancer can be prevented. So we have to advise for all of our patients, so that after 30 years of age, female actually have to go for a pap smear. So if it is not 30 years, absolutely after 40 years, it is very, very needed for every female individual, because there is a change in the hormonal level. There is a change in the hormonal level, so it can lead to the transformation. Now, this is how they change it. This is the cervix. All of just now I have mentioned. This is the cervix, ectocervix, and the endocervix. These are the normal cells, and these normal cells can be converted. Now they get converted in this way. These are the two dysplasia condition, and this is the cervical cancer. Now these two conditions, these are the cervical squamous cell abnormalities. So the normal can convert it to a low-grade squamous intraepithelial lesion. We'll discuss this matter in our coming slides. Then it can be converted to a high-grade squamous intraepithelial lesion, and ultimately, if it is not controlled, it will be can convert it to cancer. So these cervical change, what we observe, these have to be detected early, and these have to be treated. So it can be easily detected and easily it can be prevented. Now, this is a simple pap smear. All of you know, cells are being scraped from the cervix, and after this, the cells are being processed, and it has been examined. Before that, the slides, whatever made from this cells, they have to be stained, and the process of that staining is the pap staining method. We are not going to discuss all those details. So after pap staining, those all are observed in the microscope, and we used to see the abnormalities, whether there is any kind of abnormalities or not. Now, this is very important for us. This is the Bethesda system for reporting, because the pap smear, whatever we used to diagnose, these diagnosis have to be done under some rules and regulation. Now, what is this rules and regulation? This rules and regulation is been given by an authority, and that authority is the Bethesda system for reporting cervical cytology. Previously, those pap smear used to be diagnosed by every pathologist in their own language. They call it infective, they call it as cervicitis. All these are those languages. Now they have to become in one format, and this is the format very important for us. I'm not going to discuss this format. Only this is the authority. Thus, I am to say that, and these slides are under this authority. They said that the specimen may be tested under, it may be a conventional method or it may be a liquid-based preparation method. So they said if the specimen is adequate or not, that also you have to mention. If not adequate, then also you have to mention what are the, why it is not adequate. Then you have to see, these are the three things you have to see under the pap smear. You have to see whether the pap smear is negative for any intraepithelial lesion for malignancy or not, or you may have to see any interpretation of endometrial cells is there or not, or you may have to see any epithelial cell abnormalities or not. So today our discussion is on this part, epithelial cell abnormality. So I'm not going to discuss the other part. The other part, this is the non-cancerous part, which we generally call as negative for intraepithelial lesion for malignancy. This includes all the non-cancerous part. It may be any kind of an infection. It may be bacterial, it may be fungal, or it may be any kinds of pregnancy associated. These are all non-cancerous part. Now, today's discussion is that it also indicates with the epithelial cell abnormality. So this is the point that we have to keep in our mind. So what may be the epithelial cell abnormalities? What Bethesda system had said? Bethesda system had said that there are two types of epithelial cell abnormality. One is the squamous cell abnormality, another is the glandular cell abnormality. The squamous cell abnormality, all I have mentioned that the squamous cell, it may be on the ectocervix. Generally, they are the superficial cells, intermediate cells, basal or the parabasal cell. These comprises of the squamous cell abnormalities, and the glandular cells, those the endocervical cells, what I have mentioned. Those, there may be abnormality in the glandular cells also. So today, let me concise with this one because it will make a very, we cannot cover with the time. So our concern with how there will be change in the squamous cell abnormality. The squamous cell abnormalities, they are generally of 4 types. This is the atypical squamous cell. This is one which is called as ASCUS, atypical squamous cell of undermined significance, or it cannot be exclude this exclude the presence of this virus, that is human papilloma virus, which is called ASCH. And the second one, this is a low-grade squamous epithelial lesion, which is called as LSIL. Then the third one, this is a high-grade squamous intraepithelial lesion, which is called as HSSIL. And the fourth one, this is a squamous cell abnormality, a squamous cell carcinoma. So these 4 varieties of squamous cell abnormalities are detected in PET scan. And by the method of this atypical squamous cell, low-grade squamous intraepithelial lesion, and high-grade squamous intraepithelial lesion, these three are the precancerous stage. If somebody have the report of this, any one of these 3, we have to say that this is not a cancer. This is only a precancerous stage. So there should be it can be prevented or it can be treated. And the fourth one is the squamous cell carcinoma. This is the purely a malignant. This is a carcinoma of the cervix. So let us go above. So these are, I am not going to mention more detail of this Bethesda system. Now, how these are reported actually? Just now I have mentioned, this is the negative for intraepithelial lesion for malignancy. This is a non-cancerous type, and it doesn't indicate cancer, but it may indicate some other pathology also. So particularly these non-cancerous, you can see the cells are all normal. This is a intermediate, this is a superficial cell. This is a intermediate cell. Okay, this is a superficial cell. This nucleus is small. This is a intermediate cell. This is the nucleus is bigger. So there is no any kind of a cellular dysplasia over here. No cellular dysplasia. So if it appears like this, the pathologist is to give a diagnosis. This is called as NILM. This is negative for intraepithelial lesion for malignancy. Now, the second variety, it can sometimes the report can be something like this, which is called ASCUS, that is called atypical squamous cell of undermined significance, or it may include H. pylori, that is human papilloma virus. So here you can see there is a transformation. That means these cells are we are going to discuss. You can see the normal becomes slightly abnormal. The normal epithelial cell, the intermediate cells, squamous epithelial cell, the nucleus become enlarged and enlarged. Okay, we are going to discuss. So these types of finding may come, and these may be the reported. This is one of the squamous epithelial cell abnormality. Now again, this is also one of the advanced stage of squamous epithelial cell. This is called as low-grade squamous intraepithelial lesion. Here, definitely these all are transforming. The normal one, all of you have seen. The normal one, this is the normal, all of you have seen. You have seen. Now this is transforming like this, like this. So this is the dysplasia. This is the dysplasia. The nucleus is enlarging. There is a hyperchromatism. So this state is not cancer, but this is a precancerous state. So this is called as low-grade squamous intraepithelial lesion. So if this report comes to us, we have to give a particular treatment to that particular patient. Now, this is just before it is diagnosed as cancer. This is also a precancerous stage, but this is the more advanced stage. This is called as high-grade squamous intraepithelial lesion. Here, the cells, particularly, they are transforming to become malignancy. They are performing malignancy means we know the cytomorphology. That means there is a anisonucleases, there is irregular nuclear membrane, loss of basal polarity, all those whatever we study in the chapter of neoplasia, the transformation from one cell to the another cell is a cytomorphology. So we can see here all are changing, and these types of diagnosis is called as high-grade squamous intraepithelial lesion for malignancy. This is also a precancerous stage. Now, finally, this is the squamous cell carcinoma. Those cells now it become a perfectly, it is called, they become malignant. So these are the squamous epithelial cells. So all the theoretical part, whatever it is lesion mentioned in the neoplasia chapter, you can find out over here how it looks. This is so when it comes to a squamous cell carcinoma, so now it is diagnosed as a cervical cancer. But before this, all are not cancer. They are called as precancerous stage. So these all are diagnosed by pap smear and a pap smear report. Now, this is a pap smear report. This is a report from my institute, that is from the Government Ayurvedic College Hospital, Jalukbari, Guwahati. From the under Department of Rog Nidan, we are doing the pap smear, and this is how we do the report. That means the nature of the sample, there is a clinical history, clinical finding, comment on adequacy, satisfactory for comment, and the microscopic finding. This is one example I have just given to you. There's a smear shows superficial and intermediate squamous epithelial cells. Few superficial squamous epithelial cells showed mild nuclear enlargement with regular borders. Smear shows inflammatory cells in the background. Transformation zone cell are seen. So ultimately, the impression is given as ASC-US, that is atypical squamous cell of undermined significance. So this is one variety of squamous cell abnormality. Now, my question is that this is a report based on the Bethesda system, and these are the report we have to see for our patients also. Now, the question is that after observing these types of reports, can we go for a Ayurvedic treatment or not? This is the question for a Ayurvedic doctor. Now, for this, the interpretation of these types of reports are important. So that's why I have tried to interpret these types of findings. So let us come for the next slides. So this is why interpretation of squamous cell abnormality in Ayurveda is the need of hour. So before that, we have to understand whether these abnormalities or these types of pathology, histopathology, is it mentioned in Ayurveda or not? So when we consider that, we have to understand, then you have to go through the text. So when we go to the text, whether the cytology of cervix or the cytology in Ayurveda, is it mentioned or not? Now, actually, it should not be cytology of the cervix. I have to say the understanding of cytology in Ayurveda. This is a misprint, actually. I'm very sorry. We can call cytology in Ayurveda, whether this is mentioned or not. So this is a very common slope. All of you know that is from the Charak Samhita Sarir Sthan, where it is said that Sarirava Abhayavastu Paramanu Bheda Aparishankhya Bhavanti Ati Bahatvat Ati Shukshmat Ati Indre Tatvasa Tesha Sanjoge Vibhage Paramanu Karanang Vayu Karma Svabhavasya. It directly indicates that the human body is made up of innumerable paramanus. Innumerable paramanus. Now, what are those innumerable paramanus? We have to consider that we also know that the human body is made up of thousands of cells. About to say 80 to 70 trillion cells are present in a human body. So we can consider that what Charak have mentioned about the paramanu, that means the paramanus are the cells only. So paramanus are the cells, and these paramanus, they are divided or they are united by the actions of Vayu. That is Sanjog and Vibhag. This is the action of Vayu, and Vayu is helpful for the cell division of the body. So whenever there is excessive cell division, what we see in malignancy, there is excessive, uncoordinated, purposeless growth in malignancy. So this excessive proliferation of the cell is actually the action of the Vayu. And here, coming to our context of cervix, the cells of the cervix, we can call these are the Paramanus of the Garbhasaya. So it is just the interpretation. Cells of the cervix, it is not mentioned in Ayurveda indirectly, but indirectly it is mentioned that there are Paramanus in the whole body. That means there may be Paramanus in the Garbhasaya also. So these are actually the Garbhasaya Paramanu. These are thousands of cells are here. So this is the modern have given different names like squamous cell, columnar cells, but we togetherly call that these all are the Garbhasaya Paramanu. Now, coming to the pathology or the cytopathology in Ayurveda. Now, just now I have mentioned that there is a division that is, or the united that is controlled by the Vayu. So whenever there is a pathology in the body, there may be some actions of the three doshas. So looking to the three doshas, if you see the karma of the Vayu, the action of the Vayu, it is very interesting for all of us. This is a sloka that is comes from the Charak Samhita Sutrasthan, 20 number chapter, 12 number chapter sloka, where the Vayu karma is mentioned as the Evang Vidhi Tattva cha Vayuhu karma swalaksanam idam asyam bhavanti tang tang sharira avayvam avashitam. That means Vayu can enter inside any avayavas. Vayu can enter any avayavas, means Vayu can also enter inside a cell. Taddatha Srangsra Brahmsa Vyasa Sangha Veda Sada Harsa Tarsa Kampa Chala Toda Testa Adinam Tatha Khara Purushadi, etc. All the slokas what is mentioned over here, these are the Vayu karmas. So I understand in some way that Vayu, the aggravated Vayu, can enter any cell, and when this aggravated Vayu enter any cell, there may be change in the cell. The morphology of the particular cell can change. Now, how it gets changes? It can changes like this, like Srangsra Vrangsha. How we will discuss. The same context is also described by Bhagavad under Sutrasthan, 12 number chapter 49. Srangsha Vyasa Vyadha Sapas. This is the sloka. The similar sloka like Charaka. So the Vayu karmas, if you go on explaining, so these are the literary meaning. Sramsa means looseness, Brahmsa means dislocation, Vyasa means expansion and division, Sangha means obstruction. These are some of the literary meaning, how we understand in the modern language. Now, can we see this? Now, while observing the pap smear, actually, this is my thinking. When I used to see inside the microscope, when we see the properties of Vayu, when we see the guna of Vayu, when we see the karma of Vayu, generally the dosha we used to examine on our patients. And when we examine our patient, we used to see those symptoms. But from my point of view, this can be observed inside the microscope also, because all are made of Pancha Mahabhut. So inside the microscope or inside the cell, these properties are present or not. So I have looked like this way. In this cell, Vayu gets enter, and the aggravated Vayu, it causes the cytomorphology. That means there is a change inside the cell. Now, how these changes occur, we'll discuss. So here, Chakrapani says that these Vayu karmas are not normal. They are the Vikrita Vayu karma. That means these actions of the Vayus are pathological when it enters any part of the body. And aggravated Vayu, when enter inside any cell, it may change the structure and function of the cell. And Vayu karmas are actually the effect of the structural abnormality of a cell or tissue. So aggravated Vayu, a Paramanu transform into a Vikrita Paramanu. So a Paramanu, which was a normal cell, after the aggravated Vayu, when it enters, it transforms into a Vikrita Paramanu, or you can call as a pathological cell. Now, what are Vikrita Paramanu? This is the pictorial presentation. A normal cell, when Vayu get enter inside, it transform. There is a mutation inside it, and it transform to a cancer cell. It can transform to a malignant tumor. This is actually transformation of a paramanu to a Vikrita Paramanu. This is only due to the involvement of Vata dosh or Vayu. Now, I understand the Vayu karma inside the microscope like this. I may be wrong because I have just said that this is only my interpretation. Lots of discussion and inputs is necessary. How I understand, I have observed that inside the microscope, I used to see something like this. Now, when I observe, this is a normal cell. This is a normal cell, and sometimes it becomes abnormal. This nucleus is expanded, and here I have shown that the color of this particular nucleus is become hyperchromatic. So hyperchromatism or hyperchromasia, actually it is indication of a malignant cell transformation that we see it in our neoplasia chapter also. So this hyperchromasia can be called as Syava Varna of Paraman. Syava Varna of the Paraman. And Syava Varna, this is a Vayu karma. Then here you can see this nucleus become irregular. This is the nucleus, this is become irregular. So all these irregular nucleus, this is the irregular nuclear border, it is due to the Khara and the Ruksha guna of Vayu. So this Khara and the Rukshas are also the proper or the gunas or the karmas of the Vayu. So this is normally this Khara and Ruksha is only due to when the Vayu get enter inside, the nucleus become Ruksha or Khara. There generally we see inside in our patients, in clinical condition, we used to see in our patients while examining, there is a Rukshata, there is a Kharata of the part, there is a Kharata of the skin. Also, it can be observed inside the nucleus. Now here, the same thing, the nucleus is enlarged. Here you can see the nucleus is enlarged. Nucleus is enlarged. This is an intermediate cell, and intermediate cell nucleus, it is about only 50 micrometer in diameter. Now it has covered the whole nucleus, a whole cell. Now when this nucleus is enlarged, I consider that this is due to the action of Vayu, and this is the Vyasana. Vyasana means expansion. So the nucleus is expanded, and this is only due to the action of Vayu, the nucleus is enlarged. So this is a cancerous or a precancerous state. Now here there is the Sushira, that means the nucleus becomes here porous. The nucleus becomes porous. So here this is the nucleus become porous. This also we also find out in many conditions like perinuclear halo. The perinuclear halo is actually a finding when there is an involvement of the human papilloma virus. So when the virus affects the cell, it transforms into malignancy. So it produces the haloness. So when these haloness are seen, you can see there is a porosity in the nucleus. So I have found that this can be interpreted with Sushira, or it can be interpreted with Purusha. Now, all of you know that means the this is the normal cell, and the nucleus is residing in the basement membrane. Now, whenever there is such type of involvement, you can see there is loss of basal polarity. So loss of basal polarity is one of the cytomorphological found in the malignancy. So here, loss of basal polarity can be considered as Sramsa or Bhramsa. Sramsa means dislocation, Bhramsa means from the dislocation from that part. So these are also can be considered as Vayu karma. now here Aruna Varna. Now these actually cells, these excessive keratin are deposit, excessive keratin deposit, and when the excessive keratin deposit, it transform into these keratinized cells. They look like reddish color, or they look like Aruna Varna. So Aruna Varna, we can call these excessive keratinized cells, which is a very diagnostic part of a precancerous or cancerous state. This is maybe due to Vayu, karma, or involvement of Vayu. So here, already I have discussed that squamous cell abnormality in cervical dysplasia may be of 4 different types. Atypical squamous cell of undermined significance, low-grade squamous intraepithelial lesion, high-grade squamous intraepithelial lesion, and squamous cell carcinoma. So let us see how we can find the Ayurvedic interpretation of all these 4 varieties. The interpretation of squamous cell. Now, this is the criteria of diagnosis for atypical squamous cell. How atypical squamous cell is diagnosed? Here, it is said in the book that the nuclei are slightly bigger than the normal cell, slightly increased ratio of the nuclear to cytoplasmic ratio, and there may be minimal nuclear irregularities in the shape. So this is what written in the book. You can see here, nuclei is slightly bigger. Now here, this is the normal cell, and these are the normal cells. Now the nucleus becomes slightly bigger, and here the NC ratio, that is the nucleocytoplasmic ratio, is slightly higher, and there is a minimum irregularities. Just there is a minimum irregularities. So there are cells to become cancerous. It is the first step. So that is called as the atypical squamous cell of undermined significance. Now, if this is how we can interpret in Ayurveda. In Ayurveda, we can call that there is alpa vyasana of the Garbhasaya Paramanu. So these are the Garbhasaya Paramanu, and there is a slight increase in the size of the nucleus, and there is a slight, so we have to go for a gradation. So that slight can be graded as alpha vyasana. That is, there is a mild vyasana we can find out in this paramanu, and there is a alpha khara of Garbhasaya. That means mild nuclear irregularities. Mild nuclear irregularities. Irregularities are there, but very mild nuclear irregularities. So this can be called as alpha khara of Garbhasaya paramanu. Here the vata involvement is there, but the vayu involvement is of minimum grade. Now here the low grade squamous intraepithelial lesion. Here the criteria for diagnosis is the nuclei is 3 times enlarged than the normal. This is very important. The nucleus become 3 times, 3 guna बढ़ जाता है. That means the cell, the nucleus, you can see the normal cell now it become enlarged to 3 times. This is one enlarged nuclei. This is one enlarged nuclei. This is also one enlarged nuclei. It have enlarged to 3 times. Then hyperchromasia, and finally granular chromatin. The nucleus become hyperchromatic. It is deeply stained. So these are deeply stained. Earlier, those are not deeply stained. So these are called as the hyperchromatic. There will be irregular membrane. The nucleoli in species nucleocytoplasmic ratio and coleocytes. So these are the findings. We get it, and these are diagnosed as low-grade squamous intraepithelial lesion. Now, can you interpret here? Yes, we can interpret here. You can see the vyasana is of 3-fold. So this is a triguna vyasana of Garbhasaya Paramanu. The Garbhasaya Paramanu is enlarged with 3 times. This is triguna vyasana. And the Syava Varna of the Garbhasaya Paramanu. The Paramanus were not having excessive Syava Varna. So now it becomes Syava Varna. And there will be Kharata and Purusha of the Garbhasaya Paramanu, already discussed. So like this way we can interpret. This is a high-grade squamous intraepithelial lesion. Here the nuclei are hyperchromatic with coarse chromating. Now nucleus become more hyperchromatic. Earlier you can see the nucleus was hyperchromatic, but now here the nucleus become more hyperchromatic. Means the color of the nucleus become very deeply stained. And the second one, the nuclear membrane is markedly irregular. That means earlier there was a mild irregularity. Now there is a marked irregularity in the nuclear membrane, and the nucleoli are visible, high NC ratio, cytoplasm is keratinized. So this is how they are diagnosed according to the modern books. Now in Ayurveda, we can call that as because we have make it a gradation. Now when it is a case of a excessive, so we call it as ati. So I have used the word ati. Here it will be ati vyasana of Garbhasaya Paramanu, ati Shyava Varna of Garbhasaya Paramanu, that is Aruna Varna of Garbhasaya Paramanu, that is a keratinized cell, and ati Kharata of the Garbhasaya Paramanu. So these are only the actually सक्सेसिव स्टेज. ये वही स्टेज है जो पहले था तब से अभी बढ़ गया है, बस उतना ही है. दिस इज ओनली a transformation. That means in a particular time it may be normal, and when in due course it may change from low grade to high grade. So this is only a transformation. So I have used the word ati. So this is the same way. Now this is the squamous cell carcinoma. Here you can see severe anisonucleosis. No cell is similar. Every cell is similar. Every cells are you can say different. Every cell are different. कोई छोटा है तो कोई बड़ा है तो अच्छा है, तो मतलब every are all are different. So this is called marked anisonucleosis. There is marked irregular nuclear membrane. All the nuclear membranes are irregular, coarsely clumped chromatin, hyperkeratosis, tumor diastasis. When we see this is diagnosed as a case of a squamous cell carcinoma. Now, it can be understood in Ayurveda like Ati Sankosha and Ati Vyasana. Ati Sankosha and Ati Vyasana means अगर एक सेल बहुत छोटा है और एक सेल बहुत बड़ा है, मतलब इसमें कोई डिफरेंस है. छोटा किस लिए हो रहा है? ड्यू टू संकोचना. और ये एनलार्ज क्यों हो गया? ड्यू टू व्याचना. सो अति संकोचना, अति व्यासना, अति खरा, अति पुरुषा, अति अरुण वर्ण, सुशीरा परमाणु, ऑल ये जो इंटरप्रिटेशन है, these interpretation indicate that there is excessive involvement of vata dosha inside this cell, and when there is excessive involvement of vata dosha, it produces various karmas. आप देख रहे होंगे इससे पहले इधर से अगर हम लोग थोड़ा सा इंटरप्रिटेशन करेंगे, यहाँ में एक या दो कर्म है. वायु का कर्म सिर्फ अल्प व्यासन और अल्प खरा है. then you can see vyasana, syavavarna, khara purusha. That means vayu karma is now here seems to be more in number. Like that in high grade squamous intraepithelial lesion also you can get some more vayu karma, and at last in the squamous cell carcinoma you can see many of the vayu karmas are present inside the cell. Now coming to the last, to the summary. Now coming to the summary, therefore in squamous epithelial cell abnormality, cervical dysplasia, various changes that occur in the cell can be interpreted in Ayurveda as: firstly, the squamous epithelial cell abnormalities are the results of vayu karma, where paramanu transform into a vikrita paramanu. A paramanu hota hai, ultimately it get transformed into a vikrita paramanu, and the culprit is the aggravated vayu which get enter and produces various karmas. Now, atypical squamous cell of undermined significance can be interpreted as the avastha of the vikrita paramanu of Garbhasaya due to involvement of aggravated vayu showing alpha vyasana, alpha khara vayu karma. मतलब यहाँ में वायु कर्म है, अल्प व्यासन है, अल्प खरा, it can minimum, and ultimately that's why there is a slight change that is called as a atypical squamous cell of undermined significance. Then low-grade squamous intraepithelial lesion can be interpreted as a avastha of Vikrita Paramanu of Garbhashaya due to involvement of aggravated Vayu showing Triguna Vyasana of Garbhashaya Paramanu with Syava Varna, Kharata, Purusha, Garbhashaya Paramanu. Means here we see many of the Vayu karmas are involved and it indicates moderate changes of the Paramanu. Now, similarly, the high-grade squamous intraepithelial lesion can be interpreted as avastha of Vikrita Paramanu of Garbhashaya due to involvement of Vayu karmas like Ati Vyasana, Ati Syava Varana, Aruna Varana, Ati Kharata, etc. And squamous cell carcinoma can be interpreted as a avastha of Vikrita Paramanu of Garbhashaya due to involvement of aggravated Vayu showing Ati Sankosha, Ati Vyasana, Ati Khara, Ati Aruna, Sushira, and Purisha Paramanu. So these are actually the language that we can actually also interpret in our report. अगर कल जाके हमें अगर बोला जाता है कि you can use the modern text technology but you cannot use the modern terminology, तो हम लोग पैप स्मेयर करके ऐसा रिपोर्टिंग कर सकते हैं और ये करके हम लोग अपना पेशेंट को और अपने क्लिनिशियन को कुछ ना कुछ तो इंफॉर्मेशन दे सकता है जिसके आधार पे ए पेशेंट कैन बी ट्रीटेड. कैसा ट्रीटमेंट? जैसे कि जनरल प्रिंसिपल ऑफ ट्रीटमेंट टू रिड्यूस एग्रेवेटेड वायु इन सेलुलर लेवल लाइक रसायन चिकित्सा, स्नेहपान may be helpful to prevent squamous cell abnormality can be adopted. तो ऐसा अगर है तो अगर क्लिनिशियन को लगता है कि हमें वात का प्रकोप है तो उसी वात का प्रकोप को ट्रीटमेंट के लिए टेक्स्ट में जैसे लिखा है वात प्रकोप का चिकित्सा जैसे करना है उसका हम आधार करते, लेकिन ये अब जब करेंगे वो एविडेंस बेस्ड होगा. This will be on the evidence base and many more works have to be done. I am involved in the oncology part here in Government Ayurvedic College Guwahati. So many patients are coming. So there is something that I am trying in that level whether the Ayurveda interpretation can be helpful or not. And I'm getting results also. So in due time, I can say this is only a very primitive stage. I cannot say much more about that. So people have to gather together. We have to work together. And then the Ayurvedic people also can say that we have also got a evidence-based treatment. So this is what the small presentation I have came to all of you. So thank you. So thank you to all of you. So thank you specially to Rog Vigyan, Vigyan PG Association. Thank you to Subhas Wage sir. Thank you to Santosh Rohan sir for giving me the opportunity to say something in front of you. Or there are lots of things have to be done. This is only my part, whatever I have understood. And we have to go together and we have to do something new for Ayurveda. Thank you very much.
Thank you, sir. Thank you. Thank you very much, sir, for a very informative and integrated approach on interpretation of squamous epithelial cell abnormalities in Ayurveda with special reference to cervical dysplasia. I hope our PG students would have taken a lot of benefits from this lecture, sir. Anyone having a question, please ask.
Sir, this is a very wonderful and very beautiful presentation on your part and rather inspiring one. Just I want to ask whether you use these terminologies, Stansa, Vyasa, etc., in interpreting the other cancers also?
Yes, sir. Thank you very much, sir. Actually, yeah, this is when we go for any kind of a histopathological study, and when the report that come to us, the thing that I always used to try to interpret this in my language, in Ayurvedic language, and definitely many of the cases we used to treat on that part only by interpretation.
Apart from this, would you like to suggest the HPV vaccination for all adolescent girls to prevent
Yeah,
this?
yeah, definitely. HPV vaccination is very essential actually. So why the government of India have said that after 30 years of age, and particularly after 40 years, it is necessary for every lady to have a check for the pap smear, because HPV is one of the major culprit for cervical dysplasia. So this can be easily controlled when somebody get a vaccination, and actually vaccination is necessary. But nowadays, whatever, there should be we should have to go to the society regarding the importance of this vaccination. And I can say that where we can go, where we'll going to go to the society. So this type of information, when you spread to our people, then definitely it will be more helpful.
Okay, thank you, sir. One more that many gynecologists I had seen when there is differentiation between adenocarcinoma and squamous cell carcinoma. In adenocarcinoma, they preserve the uterus, and while in squamous cell carcinoma, they advise total hysterectomy.
Yeah.
So yes, why this is so?
No, actually, what happened? You see, this what you call adenocarcinomas are generally from those endocervical regions. That means whatever I have said from the endocervix part, and those endocervical part are preserved actually because they are not as aggravating as like the squamous epithelial cells. So for the case of these squamous epithelial cells, they are more aggravating. So that's why they are first they are operated, and after that the succeeding the chemotherapies or radiation what is necessary, it is promptly given actually.
Okay, thank you, sir.
Thank you, sir.
Add here, sir. Again, sir. The why squamous cell carcinoma, because near about 80 to 90% of the cervical cancer composing of the squamous cell. Only 10 to 20% of adenocarcinoma.
Right.
Yes, that's right. I worked in gynec department for a long time at the Government Ayurvedic College, Nagpur, and I had a chance to witness all these types of varieties, and then in cancer hospital, RST Cancer Hospital also. Just I recall my days.
Yeah.
Yes, sir.
Thank you, sir. Thank you very much. Now I would like to request Dr. Santosh Chavan, sir, for a chairperson remark.
Yeah. Okay. Thank you, sir. First, I would like to thank for giving me an opportunity to chair today's webinar as a chairperson to our organizing secretary, which is a very young and dynamic Dr. Hemant Panchade, sir, and our dynamic president of Ayurveda, Dr. Subhash Wage, sir. It's a very privilege for me to chair today's session of Dr. Hemant Kalita. Dr. Hemant Kalita, sir, is my senior at Tiyak Ayurveda College, Pune. Really, today, sir has talked in very concise, elaborative, explorative concept of Ayurveda, who can interpretation. Because as a pathologist, it is our important role to interpret the findings of any cancer. Okay, so really it is a very great effort by Dr. Hemant Kalita, sir. How can we interpret our Ayurvedic concept with modern available technologies? Because in this era of science, our apex body, Ayush and NCISF are trying to integrate our traditional knowledge in evidence-based medicine, and it is the need of our. Yes, Hemant sir, to interpret. So I request to all of your Rognidan PG that whatever the knowledge of the Ayurveda or whatever the knowledge of modern science are not difficult, but being our pathologist, Ayurveda is our duty to have a knowledge of basic technology of pathology of modern science. So really, sir, I am very thankful today sharing your session. You have given a good interpretation. How can collaborate Ayurveda and modern? So really, I congratulate. Thank you to you. Over to you.
My thanks to Dr. Santosh Sahan sir. Actually, we have worked together for many years actually during our postgraduates.
Yeah.
So it's my privilege that now we are in different places, but definitely we may be in different places. We can work together now also. So I request that a common forum have to come together so that we can develop our Ayurveda. Thank you, Santosh sir.
Yeah.
Thank you, sir.
Hemant sir, you are not audible.
Sorry, sir. Sorry. Now I would like to request Dr. Nandakishore Kale, sir, for vote thanks.
Hello. Can I
Yes, sir.
audible?
Yes, yes.
Sir. Okay. I will be very thankful to today's speaker, Dr. Hemant Kalita sir. I have heard the name of Hemant Kalita sir, but I have today saw them on the screen, and the lecture was very wonderful, very informative, very practical approach. I will be very thankful to Dr. Hemant Kalita sir on the behalf of रोग निदान विकृति विज्ञान PG Association. Very much thankful to you, sir. Also, I will be greatly thankful to my dear friend, Dr. Santosh Chavan, sir. He is a very practical person, very having the practical knowledge of this today's chairperson, Dr. Santosh Chavan, sir. Very, very thank you to you. And also, these today's sessions, our respected president, Dr. Subhash Wage, sir, very knowledgeable, very enthusiastic person to propagate the knowledge of Ayurveda as well as modern science. Very much the person having the deep knowledge and very curious person regarding the Ayurveda and all the holistic sciences which are existing. Also thankful to Dr. Subhash Wage sir, the president of RVPGA, and I am very much thankful to Dr. Hemant Panchade sir, the organizing secretary. Very sir has told the very enthusiastic person, very knowledgeable person of this today's session. Also very much thankful to all the faculties of Rognidan and all the PG students concerning the Rognidan subject. And I am very much thankful to again the team RVPGA and especially the president, our president, Dr. Subhash Wage sir, for initiating such a good knowledge movement to propagate this knowledge into the PG students, especially their emphasis is on to give the practical knowledge, especially we are all the Nidan faculties, they are interested to propagate the knowledge of pathology, not the and in those Dhatumal in the Ayurvedic concept and the investigative approach. This is very much important approach, I think, and the faculties are working very good. We are discussing very good regarding the peripheral smear and all these practical, but very simple. Even though the techniques are very simple, but they are very much diagnostic significance. They are having very much diagnostic significance as far as these pathological procedures are concerned. So I will be very much thankful to also the Maharashtra Council of Indian Medicine, Mumbai, for their involvement and their sponsorship, their valuable contribution in this webinar series. So again, I will be very thankful to all the speakers, all the faculties, PG students. And lastly, I will be very thankful to team RVPGA for giving me the opportunity for the vote of thanks of this valuable and important scientific session. Thank you, all of you.
Thank you.
Thank you, sir.
Thank you, sir.
Thank you.
Okay.
Thank you. Bye bye, Hemant sir. See you.
Bye, sir. Bye, sir. Bye.
Yeah, I wish you very good to wish
Chavan.
to all of you on occasion of this Ganesh Chaturthi. Yeah.
Chavan,
Hemant
sir,
sir, it's wonderful and very thought-provoking lecture. Actually, it was,
Yeah,
and hopefully all our faculties will start thinking on this line whether we can incorporate Ayurvedic terminologies while interpreting the modern pathological reports, and can we evolve a parallel system on Ayurvedic lines? So
yeah,
that is
we
very
can
important
better,
message
sir,
we got from this
hematology by
lecture. Yes.
yeah,
And
this
we
is
are
our
actually
part.
working on this, and I had already discussed with Dr. Hemant sir that we are coming with one such book, and his valuable contribution will be needed in this regard. RVPGA publication is active now, and it's ready to shoulder its responsibility.
Yeah, we will form our
Oh,
body,
sure.
sir, under his leadership. Yeah.
So thank you
Thank
very
you,
much,
sir.
everyone, very much. Thank you.
Thank
And
you. Have a
I
good
think
day.
and happy Ganesh Chaturthi to everyone. And I think Hemant, it's time to close the meeting.
Okay, sir. Okay.
Thank you, sir.
Thank you, sir.
Chavan,
Thank
sir.
you.
Yeah, Kishore,
Thank you.
Kale, sir.
Thank you, Kale sir,
Yeah,
and
see you.
for being
Very
with us.
nice to see you on today's platform of our REPGA. Yeah.
Okay, okay. Sir, I am always ready.
Yeah,
Yes,
yeah.
sir. Thank
And
you, Wage, sir. Thank you. Thank you, sir.
Kale
Thank
sir,
you.
lot much is expected from you, and hopefully you will
Yes.
also share
Yes.
your knowledge
Yes,
with
yes.
us, and particularly on
No,